right, hello everyone. Good evening and welcome to tonight's event. My name is Seisha and I'm the social media manager here at Charis Books, which is the South's oldest independent feminist bookstore, and also at Charis Circle, which is the nonprofit programming arm of Charis Books. And tonight we are so excited to host Dr. Uché Blackstock for the launch of her newest book, her debut, Legacy, A Black Physician Reckons with Racism in Medicine, which is out today and which you can purchase by clicking the teal button down below. I'm going to start off by introducing our amazing conversation partner, Elaine Welteroth, who is an award-winning journalist, a TV host, and the author of the instant New York Times bestselling book, More Than Enough, which won the 2020 NAACP Image Award for Outstanding Literary Work. After spending more than a decade climbing the ranks of magazine journalism, Elaine can now be seen on television weekly, doling out fashion industry advice as a judge on Bravo's new Project Runway. Her masterclass on redesigning your career debuted in 2021 and has helped thousands navigate career transitions. And now her popular new advice column, Ask Elaine, appears in the Washington Post, exploring how to navigate pivots in life with more ease and less angst. Very necessary. In addition to the Washington Post, her writing appears in the New York Times, British Vogue, and Time. Welcome, Elaine. And now I'm going to introduce the woman of the hour, Dr. Uché Blackstock. Dr. Blackstock is a physician and thought leader on bias and racism in healthcare. She appears on air regularly as an MSNBC medical contributor and is the founder and CEO of Advancing Health Equity, as well as a former associate professor in the Department of Emergency Medicine and the former faculty director for recruitment, retention, and inclusion in the Office of Diversity Affairs at NYU School of Medicine. A mouthful, wow. What an impressive bio. Dr. Blackstock received both her undergraduate and medical degrees from Harvard University, making her and her twin sister the first Black mother-daughter legacies from Harvard Medical School. Dr. Blackstock currently lives in her hometown of Brooklyn, New York, with her 2 school-aged children. All right, I'm going to let y'all get this event started. I'm going to pass it off to Elaine. So excited to hear this, and I'll be back on to close in a bit.
Woo! Let's do this.
Yes.
First of all, hello, everyone, and welcome to this very special virtual conversation and book celebration for Dr. Uché, who today gets to add to her incredible list of accomplishments, published author. So I know y'all are at home, but just send some love over we want to see some love in the messages. This is a celebration for you. I am so excited for you. I've had the chance to read this book, an advanced copy of this book, and I have been one of your biggest fans ever since. You are incredibly impressive, and this work that you have put out into the world, I think should be required reading for anyone going through med school, anyone in the medical industry, but also anyone who will ever interact with the medical industry, which is everyone, which is all of us, because it really, more than a memoir, it really arms us with knowledge and history and tools that we really need to be better advocates for ourselves and for the people that we love. So this is a book for everyone. I'm so excited to dive in. But first, I just have to ask you, Dr. Uché, because you've done a lot of things in your career that not a lot of people can say that they have done, especially Black women. And so I want to know from your perspective, what is harder, becoming a doctor or becoming a published author? What would you say?
Okay, let's see. I would say just the published author piece, because it's so much more condensed, felt like very, very intense and exhausting. But I have to say, becoming a physician, that journey from, pre-med to practicing physician is a very long road and a lot more work.
Not for the faint of heart. Well, how does it feel to hear the word author like associated with your name? What does it feel like to own that title finally?
I think that, as Black women, we hold so many different roles in our lives. And so now to have a role as author, as to someone who's putting ideas and stories, narratives, important discussion topics out there in the world, I feel incredibly privileged to be in this role, and just like the reception from everyone to this book, because I think it's about time that someone who had, like me, I have a lived experience as a Black woman, right? But I've also been really almost indoctrinated in this environment, in this medical environment, for many, many years, since the early 2000s when I started medical school. And so, oftentimes you're able to see things from both sides. So we have these two identities that we carry with us. I think it makes it even easier for us to see the glaring inequities that other people can't see as much.
Mm-hmm. Well, we're gonna dive into the deep end, but before that, I feel like I want to start light and fun by just asking you. I know that your first day as an author, you kicked it off with Gayle King. How did that conversation go? What was it like being interviewed by Gayle King?
I know. It was literally a dream, and Gayle literally came over to, because my twin sister Oni was with me, came over to us with a copy of Legacy, literally with about 50 different post-its in the book,
Right.
and like 4 pieces of like lined paper with questions on it. So like Gayle had done the deep dive into the book, and one thing, like she said to me, she's like, I really want to make sure we take home like these certain points. Like she was very, very serious about what she wanted the audience to get from the book. And interestingly enough, she said what you said at the beginning. She said this book should be required reading. Actually, she said for any medical student at any medical school. And it's something that, obviously I agree with, but I just think that it's interesting that you both said that, because it's the striking thing about the book.
I wonder how we make that happen. We need to offline about that later, because it must be a hard era to get that done in an era of book banning. But I for one am down to take it on. I'm down to take that challenge on.
There you are.
We can figure out things. We can do hard things, so we can figure that out, I'm sure. So let's dive right in. Just tell us what compelled you to write Legacy.
Yeah, and I think it was this idea of being able to use the personal story that I mentioned, but being a second generation Black woman physician. So Legacy has multiple meanings to the title. And it's so funny because the more people that read it, they come and tell me something else that legacy means. So legacy, when I first thought about the meaning of that word, is this idea, being a second generation Black woman physician, my sister and I being the first Black daughter legacy, mother-daughter legacy from Harvard Medical School. And this idea that, that is very, very rare, right? It's something that we're proud of, but, it's something that should not be. Like in 2024, there's another pair of Black mother-daughters that have graduated. So, but to think of all this time that these institutions have been around and we're still the only, I think it represents some of the deep-rooted problems. So that this legacy of racism in this country and in medicine. So that's the other legacy that leads us to see all of the health inequities that we see today. Like, we've talked about pain inequity before. We've talked about, the Black maternal mortality crisis. And that's something that you speak very publicly about. But I want people to understand like how to connect the dots between what we're seeing today and what we've seen in the past. That there is nothing, like I said this morning on CBS Mornings, that there's nothing inherently biologically wrong with Black people, but there's something very, very wrong with the history in this country, the systems that actually make us sick just by living and existing here. And then the third legacy, which someone told me about recently, is kind of more hidden in the book, but this idea of, me being on this journey to becoming a physician. I thought I was going to stay in academia for my entire life. And I end up actually having this, I call it radicalizing experience, as faculty member, where I'm not listened to, where I'm silenced, where I'm muzzled, and I end up leaving and starting my own health equity consulting firm and becoming a health equity advocate and having a platform and being able to make more of a difference outside of these institutions that we give so much power, value, and influence to.
Well, there's so much to dig into there. Let's start with this piece that you and your twin sister were the first female legacy graduates of Harvard Medical School, following your mother's legacy. And by the way, I just love your mother's footsteps, rather, but I just love the title, by the way, and I love all the different sort of ways that relates to the message that you're trying to put out into the world. But to have 3 Black female physicians in one family is extremely rare, and it's no small feat, especially when you consider that Black women represent only 2% of physicians in this country, which is wild and awful. Yeah. And not something to be celebrated. I think often, when we talk about first, it's said in a sort of celebratory tone, but it's actually, I think it's evidence of a broken system, and a system that really needs a lot of repair. And I think, so I want to dive in with you to talk about how do you think your family's story, which is like at the centerpiece of this book, how does that intersect with the history of racism in the medical field and in the healthcare system at large?
Right. So it all comes back to, I start the story with my mother's story of growing up in central Brooklyn to a single mom. She had 5 siblings, being raised on public assistance, like being born essentially into poverty. But, and that lack of generational wealth because of the legacy of slavery, because of Jim Crow, and then kind of like making her way to become the first person in her family to finish college. She went to Brooklyn College. And, to be in a family that big and to be the only one to go to college, we have to think about all of these barriers that she had to literally climb over that were in her place to get there. And then she went to Harvard Med School, where we always say she felt like a fish out of water, right? She was in class with someone who was a relative of Jackie Onassis. Someone's father had won the Nobel Prize in immunology. Some of the kids' parents had written the textbooks that they were using. So she was really out of sorts. But it was the same time frame where they had started diversity initiatives after MLK Jr.'s death at Harvard Med School. So she actually was in a class with a pretty, sizable number of Black students, about 10%. And so she found her people and she was able to get through, and she graduated and then came back to New York City, where she grew up, trained at Harlem Hospital, and then ended up working in the same neighborhood that she grew up in. But I tell that story because, for my sister and me, my mom was like the blueprint. Like, we were like, yeah, she was a doctor. Our pediatrician was a Black woman. All the doctors that I met growing up, or that I was around, were Black women, because my mother led an organization in Brooklyn of Black women physicians. So I always said that Oni and I grew up in this environment where we didn't realize what we were seeing was incredibly rare until we got older, and we were like, oh, wow, this is the exception and not the rule.
Mm-hmm. So the whole 2%, your mom probably helped nurture and had her hand on.
Yeah. And that's the other thing, this idea that, we mentor and train the generations. So having the presence of us, right? Having the presence of Black women in medicine is so important to bringing up the younger generation.
Absolutely. I'd love to hear you talk a little bit about what it was like for you working as a Black physician in Brooklyn, New York, where you grew up, where you saw your mom practice. Yeah. How were those experiences different? How was your experience different from your mother's, and in what ways was it all too similar?
Right. And so I think, when I look back on my mom's experience, and she wrote about this often, but a lot of the inequities that she saw when she was practicing in the 80s are still there now. So the hospital that she was practicing at, 2 of the hospitals, SUNY Downstate and Kings County that serve central Brooklyn, mostly middle income, low income predominantly Black American Caribbean area, those hospitals are still like largely underfunded. Actually, one of them is being set to close by the state, SUNY Downstate. So further depriving that community of resources, right? So there are so many parallels between what was happening in the 80s and what's happening now. And you would have thought if like 30, 40 years have passed, that we would have seen more significant advances happening within health within our neighborhoods, and we're not. We actually are seeing almost a reversal. Like we're seeing life expectancy decrease. We're seeing higher rates of chronic diseases. We're seeing, higher rates of Black maternal mortality, right? So it's like, I'm thinking to myself, these are things my mom was noticing in the 80s, right? And writing about these inequities that we're still seeing today, which I think part of it is recognizing how deeply, we've talked about this before, how deeply rooted racism is in our society, that, these practices and policies that deprive our communities of resources over time, it's so hard to get to recover, essentially, especially if our, local representatives, state representatives are not being intentional about how they're allocating resources.
I'm curious what your perspective is on not just where we are in this moment as it relates to this issue, but where we're going now that we're seeing a reversal for affirmative action, sort of at the academic institutional level. Like, how do you see that impacting the issue of health equity into the future?
Yeah, and I think it's so interesting how we see a lot of the same parallels appear throughout history. So one thing I write about in the book is the Flexner report, which I wrote. The Washington Post carried an excerpt of that part of my book yesterday. But this idea that there are policies that are created either by organizations, institutions, social institutions that lead to worsening of Black health in our communities in ways that we don't really have a full understanding of for generations to come. So, for example, the SCOTUS decision, we know is going to affect admissions to higher education. So that means colleges, universities, that means health professional schools. So if schools want to avoid, legal challenges, what that's going to mean is there's going to be a decrease in diversity of not only students who end up going to those schools, but further down the pipeline, there's going to be a decrease in the number of health professionals overall. And we know that there's this importance of racial concordance of, the physician or health professional and the patient having a similar race that helps to improve health outcomes. It's not the only thing that does, but it's a factor, right? So we know that the SCOTUS decision, while we may not see an impact today or tomorrow, that very well it could cause implications for generations to come. And I put that in parallel with this report that came out by Abraham Flexner, an educational specialist in 1910. He was commissioned by the American Medical Association and Carnegie Mellon to assess all 155 US and Canadian medical schools. And he was to hold them to the standards of Johns Hopkins University, which was, very well resourced and was at the standards of many of the Western European medical schools. But by doing so, it led to the closure. His report led to the closure of 5 out of 7 of the historically Black medical schools at that time. And so, because those schools, because of the legacy of racism, did not have the resources to provide a certain level of education and training to their students. And so there was a study that came out at the beginning of the pandemic that estimated that those 5 medical schools would have trained between 25 and 35 Black physicians. And so I wrote about how when I read that, I literally cried because I thought about the tremendous loss of resources to our communities, like not only in terms of patients that could have been cared for, but also students and trainees who could have been mentored, research that could have been focused on, because we're more likely to want to do research that positively impacts our communities. But we think about these policies, and most people in medicine didn't really know about Abraham Flexner. If they do, they see him in a very positive light. But he's also someone who was an avid racist, who thought that the only reason that Black people should be around in medical school is to help protect their white peers from getting sick. He thought that we were inferior. He thought Black medical schools were training inferior doctors. And so this is the thing, like, we see this institution of medicine is really wrapped up in people who believed and perpetuated a lot of racist notions. And so his report in 1910, the Flexner report, has had detrimental consequences on our communities. And so I felt it really important to write about in my book, because again, and that was before even the SCOTUS decision. I wrote the book, I started writing in 2021, but I thought it was important for people to understand, like, why, when we look at the physician workforce, and it even impacted other health professional schools too, why do we see so few Black health professionals? What is the reason for this? And people, may make assumptions, right? Say that we are not smart enough. We just can't get through all of the hoops and that are put forth for us. But a lot of it has to do with policies that were put in place over centuries ago that we're seeing the impact now. So again, thinking about the SCOTUS decision, I'm deeply worried about that. And I think anyone who cares deeply about our community should be worried about that. Because what are going to be the implications, and how are we going to prevent those implications? So there's some schools that right now, some medical schools that are saying we're going to get around that by just looking at socioeconomic status of our applicants. We're not going to look at race. But we know from previous studies, when you just look at socioeconomic status, that you actually are going to leave out some Black students from that, or some, other students of color. Like, that is not going to be the catch-all that's needed when we're thinking about race-conscious admissions. So yeah, that's a lot.
Where do we direct our outrage? How can we, and also where do we find hope?
I know. And I love how you're always looking. No, I love that, how you're always like, we need to like.
I'm trying, sister. I'm trying. It's getting harder and harder to be an optimist in this world. I will tell you that. But that's why we look to people like you. I hope you have an answer for us.
Yeah, I do. No, I definitely have. And I was just looking at to see what people were putting in the chat. But, I think that the answers lie in different places, that we can't, people will say, just vote. And yes, voting, we know, is useful in some ways, but I also think it's so important to look what's happening in our communities on a hyper local and local level. So I know that, in terms of like birthing centers, you have talked a lot about birthing centers. How can we think about ways that we can get our our local representation, or representatives rather, community to support locally centered health efforts, right? And so this is something I write about, that Alondra Nelson, who worked in the Biden administration, but she wrote about the Black Panthers previously. She found this data, or this research, that showed in the 60s, like they were running free clinics in Berkeley, right? Free medical clinics. They were doing free food giveaways. They were doing sickle cell testing. They were finding ways to, on a local level, improve the health of our communities. And so thinking about birthing centers, there's a birthing center in Minneapolis called the Roots Birthing Center, Black owned by a Black midwife, that's in Minneapolis. And they've shown already, just preliminarily, that just having that birthing center there, the birthing people who go there, they've been able to lower preterm complications, improve pregnancy outcomes. So how can we be creative in thinking about funding local and hyper-local efforts? Because we know that's where health outcomes really can improve.
Well, I have my ideas about that. But that'll be for round 2 of our conversation. I I want to get back to, I mean, you've outlined, and we all know the importance of having Black healthcare professionals in hospital settings and in medical, in the medical environment. Oh, can you hear me?
No, yeah, I just wanted to say, no, I see people in the chat were saying that, like, the Free People's medical clinics, like these
Oh
were
yeah.
clinics in the past that, you know, people could just walk in and get care.
Is that a model that we can revive? And
I think it should be a model. I think that, you know, it's like, why reinvent the wheel when we can learn from history, when we can learn from organizations that were already, you know, deeply rooted and embedded in our communities, that knew our communities very well, and had programs that kind of had a more holistic idea of what health looks like. So this idea of health in all policies. So health, thinking about health in education, housing, employment, right? Just even legal, making sure that people, you know, we know if people are housing insecure, that's going to impact their health. So how can we think about health in different ways other than what we typically think of as happening between a health professional and a patient? So I see some people
Deborah,
writing. Yeah, go ahead, Deborah. Mm-hmm.
I was just echo something that I saw come through in the chat. Deborah says, agree with Jasmine, community involvement and grassroots efforts are the answer. We have to start thinking about how to operate outside institutions. And that actually cues up my next question for you, which is, I'd love to hear a little bit about why you decided to step outside of the institution of, you know, working as a physician in the hospital setting that you
Yeah.
were in, when we know how important it is to have Black healthcare professionals in those settings. And I'm sure I speak for many of the people that are watching, like I've personally benefited from having the experience of working with a Black
Right.
woman. And in my case, it was a midwife who was completely essential in my health journey. And the care that I received was, and it was just transformative in my pregnancy journey. And by the way, Dr. Uché, I've actually never shared this with you because I didn't make the connection until after we met, but you helped save the life of someone who is very dear to me. And I learned about you and your work before I actually met you because of the impact you had on her life. I mean, I remember getting this chilling text message that a dear friend of mine was admitted into the ER and they did not know what was wrong with her. And she was sort of being ignored while her health was rapidly decreasing and declining rather. And you came to her rescue and you weren't even the doctor assigned to her. And you were able to give her a diagnosis. She found out that day because of you that she has diabetes. Yeah. And because of your diagnosis, you saved her life. And I remember rushing to the hospital, hearing about the impact that you had on her. And I just thought, I wish I could thank that angel that happened to come in at the moment that she needed you. And then as the universe would have it, you and I find ourselves working together on set. And I realized after the fact that you were that angel. You were that life-saving angel that came to the rescue for my friend. So first of all, I just want to say thank you for that. And for all, I can imagine that she is just one of countless lives that you have touched and saved during your career as a physician. So thank you. And also tell us why you decided to leave that very important role to start working on the issue of health equity from outside the system.
I mean, yeah, and when I get DMs and emails from people saying, you're the doctor that took care of me and you listened to me and you made the correct diagnosis and you saw me. And you really saw me. I'm like, oh goodness, this is why I really need to be there. But at the same time, and this is the other thing, is that a lot of times within these institutions, and it seemed like in corporate America to some degree, a lot of times we can't really truly be our authentic selves. We can't speak up because we fear that we're going to be retaliated against. So there's this whole idea of like this pet to threat phenomenon that this psychologist Keisha Thomas came up with, and and it applies to Black women and women of color very, very often. And I know, yeah. So like,
no, but I
into
think
an
anyone who's not familiar with that,
you're like the
that
golden.
term.
Right. Yeah. So you go into the organization as the golden child, like they welcome you, like, oh, we're so happy to have you here. Like, you're so amazing. You're so great. We're glad to have your skills. And then you get to working within the organization, and then you start noticing things, and then you want to speak up about what you're noticing, things that maybe seem inequitable, or, you want to address certain things that from your view as a Black woman and your perspective, you think things can, improve and get better. And what happens is that then you actually become a threat. And so you go from being this golden child to being this problem child, and then you start becoming isolated.
How many of you in this comment section have experienced this? If so, I need y'all to make some noise in this comment section. Go ahead. Continue,
Yes.
Dr. Uché.
Yes. So you start feeling isolated, and then they push you out. And then they try to push you out of the organization or do things to make staying seem incredibly untenable. Like you're like, I just don't want to stay. And so that's what I had to balance. Like I know a lot of people who have stayed within work environments. And the thing is, the same things that happen in, healthcare, medicine, are the same things that happen in other aspects of America, of corporate America, So like we've all been through similar experiences. So I had to take this experience and say, okay, Uché, you are these multiple experiences of where I was being silenced. I couldn't do the work that I wanted to do authentically around anti-racism, around equity, around health equity. And I said, you know what? I think I'm going to take this show on the road. But to make that decision was a really painful decision because I had geared up my entire career to be affiliated with the medical school, to be med school faculty. I thought that was the dream. And it turns out that wasn't the dream. Actually, the dream was really being able to show up authentically in whatever role, whatever work I was doing. So I made the decision to leave, and I said, okay, I can still practice maybe an urgent care setting. But I said, you know what? I want to develop and found my own health equity consulting firm so I can do this work as fully as I know that I can do it, and in the most impactful way. And so I always say I took a leap of faith in myself and left this really cushy environment. Like it was so, people from the outside thought I was happy. I literally had multiple roles, multiple titles. People looked at me like, girl, what is wrong? Like, what's wrong with you? Why are you leaving this? And literally, I was so unhappy. When I look at pictures of myself, I had bags under my eyes. I had lost so much weight. I wasn't really happy. And so I had to leave in order to find alignment. But the work I do now actually has even a larger impact on our communities than I had when I was stifled within that environment. So again, I feel like I'm making a bigger difference now on the outside. And I know that you've been through similar experiences. I think there's so many of us that have been.
I mean, this comment section alone is evidence of it. The amounts of girl and child that we're seeing in response to what you're saying, it's a whole amen circle. Going back to sort of the beginning a bit and back to your childhood, or not really your childhood, but during your medical training, you visited the emergency room as a patient. Can you talk about what that experience was like for you?
Yeah, and it's interesting because I talk about it in my book, and I hadn't talked about it for a while because I hadn't really grappled with what had happened. But I was a first-year medical student. I was sitting in the middle of pharmacology class, and I got this horrible abdominal pain. And I went to one of my school's teaching hospitals that evening, and I basically was told I had a stomach bug and sent home. And I got home and I felt even worse. I ended up actually having to go to the ER 2 more times over the course of the week. So 3 times total. And it got to the point where I just felt sicker and sicker. And eventually what happened was I had appendicitis, but because of the delayed diagnosis, my appendix ruptured. But it was during that experience where like I was being asked repetitive questions about like my sexual history. I shared I think I shared this early on CBS Mornings actually. I was, I was being doubted. I was wondering later on if I wasn't a young Black woman, if the diagnosis would have been found or identified earlier. Just because there were some people were like, "Are you, you sure you're not? You sure you weren't sexually active? You're sure? You're sure?" Like as if like there were so many other things going on. I know. And I was a first year medical student, and there were people that I had seen around the hospital that were caring for me. So it was a really compromising experience. And I remember my sister and my sister was only, I think, a second year student then. And she said, "I think you have appendicitis," but we were too scared to actually speak up. So even as medical students, we were too scared to speak up to the team to say, "We think you have the diagnosis wrong." Right. So if we as medical students feel too scared to speak up, then we can, imagine.
How does the person feel? Mm-hmm.
No, yeah. So that's why I always say that experience as a medical student forever changed how I viewed even being a physician. Like not everyone should have that experience on both sides. Of course, you don't want that for people, but that experience, and then also having witnessed my mother be sick with leukemia and seeing how she was cared for in the hospital, that also made me more sensitive to my patients.
Mm-hmm. Yeah, and that's why that kind of culturally competent care is something that you typically get from someone who looks more like you, who has lived experience that you can relate to more.
Yeah, can I just say that I used to I found my primary care physician that I had for about 10 years. I looked high and low for her. I found her. She was an older Black woman. And can I tell you the number of visits I had with her where we both were crying? Because literally we were just commiserating together about just life. But it wasn't, but I felt seen. Like I felt in that interaction, I was like, I felt lighter when I left the appointment. She actually ended up having to retire early because she literally burnt out. She had so many patients that wanted to go to her because she was one of few Black women practicing at that time in Brooklyn.
It's so bittersweet. It's like, you want women like you and that doctor that, touched your life in that way. You guys deserve to live beautiful, full lives and to be happy in your day-to-day life and career. And at the same time, your absence is, I'm sure, felt and at every level. Our absence as Black women when we have to leave these institutions. So it's such a bittersweet phenomenon. But I'm so happy that you are doing the work that you're doing from the place that you are, where you sit today, and the impact that you have is so far-reaching. And this book is such a big part of the impact that you will continue to have. I want to ask, what are some of your goals today, not just as an advocate for health equity, but now as an author? This is a brand new platform for you. How do you intend to sort of use this going forward to advance your mission?
Yeah, and I think that's a question that I keep asking myself, and I have some answers for. But I will say that, it was over the last few years that my platform increased, especially during the pandemic, where I was able to serve as the go-to person for health information, and especially for our community. So I write about in the book how my barber, G, I used to have a barber when I was younger, but G, for a year, he did not want to get the COVID vaccine, right? And he saw me walking down the street one day and we connected, and he's like, can I ask you questions about the COVID vaccine? Because you're the only doctor I know. You're the only doctor I trust. And we had this conversation a week later for an hour where he asked me the most thoughtful questions and then ended up getting vaccinated 3 weeks later. And so did his adult daughter. And so I think that we can have these impacts on a higher level, even maybe as a public intellectual where, we have the exposure needed for our community to see us, one, but two, where we can also advocate on behalf of our communities. So one thing that I didn't know during the pandemic, my sister and I wrote several op-eds about how we really need to center Black communities' needs within the pandemic, right? That we need to, in terms of vaccine equity, thinking about the rollout, right? How do we meet Black community members like where they are? And I found out like a year or two later that there was a congressperson in Colorado who actually read our op-eds and used the op-eds to inform policy that they made locally.
Wow.
And so that's why I think it's so important, especially as Black women, as Black professionals, that we get our voices out there, because ultimately what's important for me is for my voice to inform policy, whether it's at a local level, state level, federal level, because our voices are just so incredibly, because I know people will listen to me, and I don't take that responsibility lightly. I know that as a physician, I know with my educational pedigree that people are going to listen more, right? So I also need to also know intently what's happening in my communities, what community members are saying, and be able to translate what we need to policymakers, because we know that's where the biggest impact happens.
Absolutely. What do you, by the way, to everyone who's watching, we're going to open up the floor to a couple of questions before we run out of time. So if you have questions, please feel free to drop them in the chat. And as we queue up the Q&A, what would you say you hope readers take away from Legacy?
So
I know that's
yeah,
a question, but
I know. I want people to be, one, informed about the history, but also what's happening current day. That puts us in a situation where we're seeing these horrific inequities, right? That we're seeing Black babies dying. They're more than twice as likely to die in their first year of life now than 15 years before the end of slavery, right? And so that is absolutely unacceptable, right? So we know it's unacceptable. We know why it's happening. The other piece is to galvanize, electrify people to act. So I end the book with a call to action. Depending who people are, where they are in their personal and professional lives, what are the things they need to be thinking about? One thing my sister talks about a lot is that we have these equity choice points in our lives where we can go with the status quo, or we can make a decision that's more equitable. So how does that show up in your personal life? How does that show up in your professional life? How does that show up when you vote? How does that show up when you donate? Right? So these are things that people can think about. And so that's what I end the book with, because I know a lot of times people read these books, they're like, okay, so what do I do now? Right? So again, I task people with different call to actions. They have to read the book to see what the call to actions are, but we need people to act. So it's not just about being informed, but acting to make a difference, because we can't let these statistics are not just statistics, they are people's lives. We're seeing Black people's lives harmed by systemic racism. And we know that there are solutions out there. There are many solutions, a lot of them at the policy level, that we need to make sure are enacted to make our communities healthier.
I mean, you're speaking to a little bit of this, but I'm going to read off the first reader question or attendee question from Nina Lynn, who's asking, how can this information be used to help the next generation? And most importantly, how do we fix such a broken system? She adds that it's quite disturbing, the attempt to isolate and frustrate people out of speaking up.
I know. And that's something that I struggle with, because I don't say, okay, if you feel like you're being silenced, you can't speak up, you have to leave, because I know there's students, some people are students and they're in a vulnerable situation. I would try to do what students do, you organize on a grassroots level. Like, there's so much that happened at medical schools and organizations because students and young people got together and wrote demand letters. Like, I can even tell you with my organization, Advancing Health Equity, how many organizations we worked with as a result of students being like, enough is enough. This is what we want. If this doesn't happen, then this is going to happen. And so I think it's just sort of recognizing the power that you do have, and using it, putting it together and using it in that context. So I think that also is something I know that it can get, and we talk about hope a lot, right? I know it's hard to maintain hope often, but there are other options also. There are other outlets that are, I think, maybe non-traditional that we need to be innovative and think about.
This is Nina Lynn again. She's asking, what's the best way to advocate for your colleagues or anyone in a healthcare setting without fear of isolation, or better off, how can we fix this problem again? But I think this question really speaks to what is the role of an advocate in a scary healthcare situation or medical environment where we might feel too scared to speak up.
Yeah, no, I always say, and this is something that pains me because I feel like we shouldn't have to do this, right? Like, the things that you shouldn't have to do, the system shouldn't be as is, but these are things. So one, I always say, like, to always bring someone with you to an appointment. And it's interesting because this video went viral on TikTok recently of a young white physician saying, why don't all my Black patients come in, and why do they have someone on FaceTime with them during appointments? And it's because often you need someone else there just to either for support, or if you're not feeling well, you're feeling vulnerable, to ask questions on your behalf, like, or just to be there to support you in general. So that's one thing. Right, exactly. And two, I think also not being scared to ask for second or third opinions. If you feel like you're not being treated properly in a setting. I know it's probably harder in emergency settings, but asking for a second opinion. You don't have to stick with that health professional. And then obviously 3, asking to speak to a supervisor, or making sure that you are, and because I hate saying all of this because it's like, it's putting the burden on us, but I also want us to make sure that we're going into situations fully informed. And I also feel like, finding health professionals that you can connect with is really about asking friends, family, peers, like, who should I go to? Who can I trust? I wish there was more of a formalized network of that for health professionals.
Mm-hmm. Maybe that's your next project, post book. Just put it out there. I would love a Yelp system for doctors, and it's like a Black healthcare whisper network, where it's just like, don't go to her. This is the experience I had. Go to this one. Like, why doesn't that exist? Or does it exist and we just don't know about it?
Well, there are, for example, Health in Her Hue is a company that's owned by Ashley Wisdom. She's a public health professional, and it's a directory of culturally responsive health professionals. And initially it started as just Black women, but now actually it's a more diverse group of health professionals. They get training in how to interact with patients. They're held accountable. There's certain metrics that they keep track of. And so Health in Her Hue is one of those resources that I would advise people to take advantage of. And it's national also.
That's really great. What is it called again? I don't think I...
Health in Her Hue.
Health and Her...
No, Health in Her Hue. Like Health in Her Hue. Yeah, I'm going to put it in the chat.
I hope you guys took note of that. Health in Her Hue was that amazing. That's an amazing reference. I'm definitely going to check that out.
There's the Earth app. Yes. The Earth app also, I don't know if you know, but I think it's the Earth one is mostly for maternal health specifically. So it's IRTH. Yeah, for birthing professionals. Thanks, Amani.
Thank you for those resources. Jasmine Cornish asks, what advice would you give to an aspiring healthcare professional that's having difficulty getting involved in public health research, specifically centered around maternal mortality and such?
Yeah, I think that there are people probably in the chat that can answer that even better than I can, but I think it's linking up with community-based organizations within your neighborhood or within your city that are already doing this work. So even some of the apps, like the Earth app, I know the founder, she started with doing community-based work, and they do research with birthing hospitals in New York City. So just sort of knowing who are the the resources in your community that you can link up with. And you can even, but I think what's important is community engaged research, really to center our communities and not think of it as more of a paternalistic relationship.
This is a very good question coming from Morgan Reed. She says, how do you stay motivated in the face of adversity, especially with a political atmosphere that is unsupportive of equity? She says, as a policy director who works with Congress, she can't even say the word equity, okay? To some Congress members, they simply won't listen to the policy ask.
I know. So it's like, I think we have to be really creative, and I see this happening. So there are still, for example, organizations that work with us that in their states they're not allowed to use certain language, but we're able to work with them about how to phrase the work in a way that is more acceptable given these new policies. But I admit that this is really troubling, like the anti-DEI, anti-racism environment that we're heading into, that could also potentially worsen with the coming election, is something that we need to be very organized about how we're going to approach, because again, we could see even worsening of already poor health outcomes.
That's very scary. And I also hate the mental gymnastics that we have to go through to sort of disguise our work or rebrand our work so that it's palatable for to meet this moment that we're in, which is an extremely challenged moment.
Yeah, and I'll just say, so there are these Black women led apps, that like the Earth app and the Health in Her Hue app, and as you know, there's so many local Black women founded organizations centered around health throughout the country that we really need to be supporting, thinking about where we're donating our dollars to, where we're doing research with. Those are the organizations.
People are saying we have questions in the question column. We have 5 more minutes. We're going to try to bang through as many of these as we can.
Remember, our friend needs to come back to do her announcements.
Okay, we're going to give her 2 minutes, and we're going to use these 3 minutes for questions. If that's okay with you, Dr. Uché, I mean, this is your party. I'm just here dancing with you. I mean, there was a question that someone had that I also have, which I will ask as a fellow author. I'm curious, what was the most important thing or the most profound thing that you learned going through this process and this journey of book writing?
I think writing a book, I realized that, even once the book is done, it's never going to be perfect, right? It's still dynamic. It's still your thoughts at a certain point in time, but you may actually, because when I read the book now, I'm like, oh my goodness, there are things I would have put in or things I would have taken out, but also to give myself grace that, This is the first book. Like, there are so many opportunities to even have like these kind of conversations over issues that may have come up or themes that may have come up that I may have wanted to delve a little bit deeper in. So like as an author, you cannot be a perfectionist, like that there is, that's why you have to
let it go.
Workbook. You got to let it go.
Absolutely. What advice do you wish that you had received as a medical student? This comes from Jemiah Mack.
The advice I wish I had received, I wish I had more mentoring from women and women that were maybe mid-career or late career that, may have prepared me more for what I encountered during my career, that may have said, oh, okay, if you want to go up for promotion, these are things that you should be looking out for or things that you should be doing. Like, I never really had, one thing I write in the book is like, really never had the mentoring that I should have had. And that's part of because I didn't have women that looked like me in that environment. So I kind of had to figure things out on my own. I also would have loved to have talked to people who had children and talk to them about, we won't say balancing, but how do you have your career, but also be a present parent? How do you care for yourself? Because I was never able to ask my mother those questions. She was only 47 and we were 19 when she passed away. So there are all these questions that I have now, about like, okay, so how, as someone who is purpose driven, who cares deeply about my career and the impact that I make, how do I do that? But then also parent intentionally and be present for my children. Like that is that I want to know people's experiences about. And I didn't have that as much as I could have.
I did see someone ask that question, and this is a great final question, and then we'll turn it back over to our host for the evening. But how do you manage to take care of yourself while being this major force for good in the world, while also being a mother to two children? What does your self-care look like?
The self care looks like many different ways. It looks like calling. It looks like having therapy every 2 weeks. It looks like, working out when I can. It looks like giving myself grace. It's a bunch of different things. It looks like saying no a lot to opportunities that maybe don't fully align with what I'm interested in, or just being really thoughtful about what I say yes to, because knowing that my time is incredibly valuable, that I'm accountable first to myself and then to my children, and that I really need to be in a good headspace and have time for myself to rest.
As I said this morning on the Today Show, I will say it again. It's a hell yes or a no. That is the best way we can walk through this world and preserve our good energy for the things that matter the most to us. And by the way, I just want to thank you all again so much for participating in this wonderful conversation, for saying hell yes to showing up tonight for Dr. Uché and for the. What's that?
Yes, thank you so much to everyone who joined.
And thank you, Dr. Uché, for giving us this gift. I hope everyone will take the time to really spend time with these pages, talk about this book, post about this book, buy this book for people in your life. It really takes a village to, as many of you guys may know, it takes a village to really make sure that a book is successful, especially a book like this one, especially in a moment like this. So let's all, my call to action to everyone tonight is just when you click that button, take 5 minutes, jot down some ideas for how you can really get behind this book. And Dr. Uché, how can you share this with people in your office and people at church, your loved ones, your friends, your family? Like, write down 5 people who would benefit from having this book, and go ahead and go on Amazon, or sorry, not Amazon. We're going to go to this bookstore online, and we are going to buy some books.
Yeah, the green below. It's right there. The green.
We're going to buy it in the link. Thank you very much. We're going to plug the link below. And with that, we will turn it back over to you, Charis. Thank you so much.
Seisha, are you there?
Unless they're giving us more time.
No, I'm here.
If you give it, we'll take it. Just know.
I would love to give y'all more time. I honestly could listen to this conversation for another 2 hours. Everyone in the chat, let's make some noise for our 2 incredible speakers tonight. This was a absolutely brilliant and very, very necessary conversation. And also, the chat was so lively.
No,
discussions going on in the chat alone. Y'all really created an incredible space tonight. So thank you again. Go crazy for Dr. Uché in the chat below. And if you are looking to buy a copy of Legacy, which every single person should be required to read this, you can purchase a copy from Charis by clicking on that teal button right below us. When you buy from Charis or you donate to Charis Circle, you're helping us keep going and put on more programs like this incredible one that we had tonight. But our time has come to an end. Again, if you haven't already given your applause to Dr. Blackstock and to Elaine in the chat, go ahead and do that. But everyone, you have a good night. Thank you for joining us. Make sure to stay warm, stay safe. Bye, y'all.
Bye, everyone. Good night.